Well, you have seen the surgery, how it is done and the early results. No doubt it is a very major surgery, but with a very high rate of success. Now, let us hear out some of the common questions about this procedure.
At what stage of arthritis do you recommend a surgery?
Early stages of arthritis usually well controlled by painkillers, injections, keyhole surgery, some physiotherapy. But when the day-to-day life becomes difficult and painful, in spite of taking regular painkillers, it's time to consider surgery. There is no point in waiting till the legs becomes very severely painful, badly bent. Certainly the benefit of surgery can be offered slightly earlier than that so that they can enjoy the benefit of the surgery.
At what age can one have the surgery done?
There is no upper age limit for this surgery. As long as the general health is satisfactory, it can be performed at any age. Sometimes in young active people below the age group of 40 years, we try to postpone the surgery. Nonetheless, if the joint is severely painful and limiting your day-to-day life, this can be performed in any age.
Can persons with diabetes or blood pressure undergo this surgery?
Yes, certainly. Many of the people do have blood pressure or diabetes problem. This is not an emergency surgery after all, so we have enough time to make sure your sugar and the blood pressure are very well controlled before you go for the surgery.
Can the bent legs be made straight?
Yes, certainly. The bent legs are made straighter by this operation. When we do the bone cuts and ligament release, the leg is made straight. With that correction, certainly you can walk better and look better.
Do you have to take a long-term medication to keep the artificial joint going?
No, there is no need for any medicines to be taken to maintain your artificial joint.
Are there any risks or complications in this surgery?
Nothing in the life is without risk. This surgery, when performed well, has got a very high rate of success. In spite of that, sometimes we do have complications. Infection is one of them. In spite of the very best precautions we have, still 1% can have an infection. Most occasions that is well controlled with antibiotics. Occasionally, one may end up in having a second surgery to correct that. Stiffness is other problem. Usually after knee replacement, you will be able to bend your knees to 100 degrees. Occasionally it can get stuck at 60 degrees. But this is not painful, so you can walk around quite a bit. With physiotherapy and exercises, these things do improve to a certain extent.
How long do the joints last after the replacement?
Like any other mechanical pieces, the artificial knee replacement do also have a wear and tear problem. With the modern day present top class quality prostheses, they are expected to last 15 to 20 years. At that time, if the situation demands, it can be done again.
How long do I have to stay in the hospital after the surgery?
Usually it's about 10 to 12 days. A day before the surgery you get admitted. Couple of days after the surgery you start walking. 10 days after the surgery the stitches are removed. Once you could walk about 30 to 40 feet with some support, you will be able to go home.
After I go home, how long do I have to take bed rest?
No, not at all. You start walking within 2-3 days after the surgery. There is no need to take any bed rest when you go home. Actually, you will be able to look after yourself to a large extent. You will be able to walk inside your house with a small support of a walker or a stick and go to the toilet, kitchen and attend to your personal duties.
Will I be able to climb up or down the stairs after the surgery?
Yes, certainly you can. After a month after the surgery, you will be able to climb up and down the stairs without any support.
What are the exercises that can be done after the surgery?
You can do your usual breathing exercises, gentle walking, swimming and other regular exercises to keep your body fit and clean.
After the surgery, how far can I walk?
If the rest of your body allows, you can certainly walk up to 1 kilometer or 2 without any problem.
My mother has got both the knees affected by arthritis. Can both the knees be replaced at the same time?
Yes, certainly. Many of the people at the advanced stage have both the right and the left legs involved by this arthritis. So many times we do both knee replacements in the same hospital admission. This certainly reduces the cost, hospital stay and other problems from the surgery.
What should I do to look after my artificial knee joint? What are all the precautions to be taken?
As I told earlier, there is no need to take any special medicines to keep the joint going. They are quite happy to be a part of your body and keep working for you. If you accidentally have a small injury around that area, you need to keep it very clean and make sure it gets healed without infection. The other thing is, it is better to keep the body weight in check so that the joint can serve long time for you.